This relevant research topic is carpal tunnel. And what we're going to look at is the clinical prediction rule for carpal tunnel. The clinical prediction rule, as many of you know, is a way that researchers pull together impairments and find out which ones really do help to predict the medical and rehabilitative problem. And again, in this case, it's carpal tunnel. The article was published in 2005 of April in the Archives of Physical Medicine and Rehab. The title is Development of a Clinical Prediction Rule of the Diagnosis of Carpal Tunnel Syndrome. There are 5 pieces to this clinical prediction rule. The first one is, does shaking your hand relieve the symptoms? And this is a great one because people who really have carpal tunnel, it's not coming from their neck, it's not an epicondylitis. When they shake their hands, they get relief, all right? So answering positive to that adds to the predictive ability of this rule. The second one is what's called the wrist ratio index. And to do the wrist ratio index, you're going to need a skin caliper. And what you do is you look at the AP measurement versus the medial lateral measurement. And you put the anterior posterior measurement over the medial lateral measurement. And what you should get is a ratio that is greater than 0.67 if it is positive for carpal tunnel, all right? And what you're looking at really is the swelling in the wrist. It's a good way to measure true swelling in the wrist. Then you're looking at the symptom severity scale of an average score of 1.9, and that is a long form, a functional tool, very well accepted. And what you do is you add up all the ones they've taken, and then you divide it by that number that they've scored, and the average should be a 2 or higher, which means they have some functional deficits. Then the fourth one is median sensory nerve loss. So when you do your sensory test for the first digit, just for the first digit, you will see that it is less, median sensory nerve loss of the first digit. And then the final one is 45 years or older. So the more they score, the more predictive it is of carpal tunnel. And come on, this is better than having a nerve conduction velocity. Ow! All right? So this is a simple one that therapists can do. Weiner, Archives of Physical Medicine, April 2005. There's the research. Use it.